narrow range that a lot of people are probably unhealthy in that 4 to 5 range. And there are studies showing, especially in women, because most of the hypothyroid, autoimmune hypothyroid is more common in women, that anything above that 2.5, that's why they use, but basically above 2, associated with higher risk of memory loss, long-term, and yes, even low bone density. Okay, it's a very narrow window for TSH that's probably optimal. Okay, free T3, young, 3.5 to 4 is the number I use for free T3. And be careful, your lab, because that's the problem. The labs that we use, they incorporate so many people. I was waiting for they incorporate so many people that are unhealthy that, you know, they really do have a lot of people who are diseased within the reference range. You don't, let's call them star doctors. If the star isn't next to it, the doctor doesn't pay attention to the test. You don't want those. Okay, you want doctors to know how to interpret tests within these reference ranges. In general, those reference ranges are great for blood count. Hemoglobin has been pretty set over the course of time, and your liver tests are pretty set over the course of time. And I'm not saying no reference ranges of any use. When I started off as a doctor, normal reference range for cholesterol was anything under 300. Oh, 299, you guys are rocking, okay? Okay, so remember, just because a reference range says it's okay, doesn't make it so. Okay. So you guys, again, fasting blood sugars, another good take-home message today because of the effects of insulin and things. Kaiser did this huge study, okay, and for a normal fasting blood sugar is 85, okay? Anything over 85, for every 1 point above 85, your risk of diabetes goes up 6%. So, I mean, my fasting blood sugar is 90. I am so cool. Yeah, it's about 30% higher risk of diabetes. Yeah, so, yeah. So, and why do I bring this up now? The reference range for blood sugars should be coming down, 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 okay? So a normal fasting blood sugar really is closer to 70 to 80, okay? And as you start to see, and why is it? Because so many people have blood sugar problems there, that reference range has been skewed, okay? And you might say, why is Gary bringing this up during the thyroid talk? Because blood sugar, insulin levels affects thyroid function. Okay, so reverse T3. This number here, most of the labs use at 350. We have such a sick population, at least less than 250. It is tough to get people down into this range. I think it's a great goal, okay? But a reverse T3 is a very important thing to measure and get down. Will you be able to get your doctor to measure it? Will it be covered by the insurances? I mean, these are all things that you have to be careful about. So, and this, remember I said when talking to a doctor, and my patients have gotten it covered, okay? I haven't had much of an issue. At some point, you know, if enough doctors are ordering it, then who knows if the insurance companies will fight back and try to keep us from ordering it, because it'll keep us from, because doing stuff like this will keep us from prescribing the preferred drugs.
So with people...
This is just for Roger.
Roger.
Equine medicine. Like most veterinary surgeons, during breezes through chops or hinds. I'm sorry, Roger. I was debating. I was thinking, there's no way. With this crowd, I love horses, by the way, but, you know, that was funny to me still. And I said, you know, gosh, he was so good. But look, how easy medicine can be if you're a veterinarian. You know, I was thinking, I was like, gosh, he had it so easy. Look what he was doing. You know? Sorry, Roger. I know I shouldn't have put that slide in there. Anyways, but, so, and this is what to do if reverse T3 is elevated. Once again, we need to measure it and then look for the cause. Is it recurring infection? Especially for my patients with recurring Epstein-Barr and those types of things. I can see reverse T3 will go up even before they get sick with their Epstein-Barr and things like that. It's a good marker of stress within the body. That's what I would just tell you. Any stressor will cause your body to go into what's going on up there. And that's reverse T3. All kinds of genetic thyroid problems because high CRP, inflammation in your body. Remember what I was saying, high insulin levels, inflammation in your body will affect thyroid function, okay? So that's why you have to be comprehensive. It isn't just the hormones. Yes, do you mean I have to measure the cardiometabolic risk factors? Yes, okay? Do I have to start measuring all these things? Cholesterol level, one of the most common. We want to find the reason for the high cholesterol, right? Not just give you a statin. Well, hypothyroidism, one of them key things that I find. You adjust and treat hypothyroidism. You treat the problems with the adrenals. Cholesterol gets better. Treat etiologies. Don't just treat the signs and the symptoms. Homocysteine. You know, oh, homocysteine is just marker B vitamins. No. Omega-3 fatty acids can lower CRP and lower the homocysteine. Okay, so good fats can help. Okay, same thing goes. B vitamins actually correcting high homocysteine can affect thyroid function because it affects thyroid hormone metabolism. Okay, appropriate iron levels, especially for ladies. Ferritin, the storage form of iron, you've got to measure that. Is that iron stores high enough for T4 to T3 conversion? Very important. Okay, so that's why when you say it's iron deficiency anemia associated with hypothyroidism, yes, it is. Okay, because you got to treat that. You always want to treat etiologies. And this is why it takes time. By the way, you have to sit down, go over the talk with the person. What's their history? What's going on? And yes, if you're still not figuring it out, I measure tests for toxicology. I measure assessments of vitamin sufficiency and things like that because we want to find out why things are going askew.
Dr. Foresman?
Just one second. Low T3, strong predictor of death in cardiac patients. Reverse T3, also one of the strongest predictors. American Journal of Medicine 10 years ago. Okay, 10 years ago, elevated reverse T3. Can't even get anybody to measure it anymore. Okay, and this is by circulation. These are all in heart journals. So people going into for any bypass surgery and things like that. I'm promising them, you got to have these things tested. You don't want these things askew before you go in for bypass surgery. You really don't. It's bad for you, extremely. Okay, and it's rampant out there. Okay, I'll let you guys read that. And this is really important. I know, and when I say endocrinologist the last time, it seems like I'm being mean to them, and I'm not. That's not my intention. I promise I'll get to the other question. But they really are more entrenched. The more you get into specialty medicine, the more entrenched the doctor is into a belief system. Okay, the more entrenched they are into a belief system, the less they are to look at evidence. Okay, and that's been my experience. And so, because if you see there's evidence that doesn't fall within your belief system, and your belief system is so that you just don't see it. Okay, I could go on and on about and this goes for all specialists. I mean, I'm doing a presentation next weekend on integrative oncology. The numbers are astounding on nutrition and treatment of cancer, astounding within their own literature about how important it is. And you go to any oncology meeting at the local, Hearst Cancer Center, and what do you get? Twinkies and donuts and all these other things. Let's just feed that tumor, It's good for business, And it's amazing, And so, so it's not just endocrinologists, subspecialty. If you practice disintegrative medicine, and that's what most people do, I've got to go to my gastroenterologist so I can get some more protonics, knock out my acid, prevent my ability to absorb any of my nutrients so I can develop all my other endocrine dysfunctions, and then I can see my endocrinologist. Thanks. You get it? Part of the system. Okay? That's what most people become. Become your own healer. Okay? And by the way, by eating healthy and detox and listening to your body, not by going on WebMD, which is meant to suck you right in. Okay? All right? That's what they're meant to do. Because the only thing you can do is take a statin if your cholesterol's high, if you believe that. Okay? Or whatever. And so, question.
When you're talking about stresses, you're not just talking about, my job, my pulling my hair out, my kids are driving me nuts. Are you talking about environmental stressors as well?
That sounded like it right there. Yes, that's exactly what I'm talking about. Of course I am. It's any stress and that's why it's stress management is home talk, right? Okay, yes, physiological stress, a surgery, okay, it can be a stress. Physical injuries can be a stress, okay? Of course, all those things. Having a physical illness, not sleeping, is a stress to your system. I mean, I don't know how many people come in with this litany of complaints and all these things affecting every quality of your life, and you ask them what their stress level is. Oh, none. Oh, denial, not just a river in Egypt. Okay, and so it's true. And come on, dude. Man, you're listening to the whole story. I'm stressed just listening to the story today. I'm gonna need some Valium. So I gotta emphasize, stress is huge, and it's everything, and it's including the physical stress of not being well. Do you understand that? Not sleeping well. And the secondary effects, and that's why things can snowball in the wrong direction. But you start to eat right a little bit more, meditate, bring the stress levels down, and then everything snowballs in the right direction without you having to think about, is this my corticohypothalamic pituitary adrenal axis going into gear now? Yes, it is. Okay, stop thinking that way and just eat right. Okay, something like that. So thyroid, and this is true. Yeah, new scientific truth. Again, we make advancements in science one funeral at a time, okay? And that's the way it goes. And so you do not get the new ideas, do not take over. Really, the old guard has to die. Seriously, that's the way it's been. And you don't want to wait for that. You have to make the changes yourself. So that's why I do spend time talking with the doctors about this as well. Okay, they're a little bit more crotchety about it, but they actually recognize the problem. That's why you see more and more doctors doing the things I'm doing, because you kind of love medicine if you get to figure things out again. And you realize seriously that you just kind of you went into medicine thinking one thing. I mean, they show that doctors, when you first year medical school, their interest in nutrition in terms of treating disease is like 90-some%. By the time they get out of medical school, it's about 30-something%, and it's almost immeasurable in specialists. Okay, we get indoctrinated, okay, into a way of believing that nutrition isn't there. Most of us went in thinking this stuff was cool, by the way. We just got beaten out of it. And you do 100-hour work weeks and do all these other types of things, life, death, this kind of things, people pounding on you. Trust me, it's pretty darn easy to go down that pathway. I have a lot of empathy, yes.
How did you survive or recover from that ideology?
It doesn't take, I don't know. I think the simplest thing I can tell you, what happened to me was very simple. I had a patient I started seeing, this is at UC Irvine. I was a faculty at that time. And I continued this prescription for naproxen, which wasn't over the counter at the time. And so I continued this prescription, and the lady almost died from a gastrointestinal bleed. Okay. And I was like, oh, I did the right. But the thing that bothered me more than her almost dying, believe it or not, was how consoling you didn't do anything wrong. You didn't do anything wrong. And medically, I hadn't done anything wrong. I mean, it was okay to do that at that time. But how wrong it was, what I did, and how right it seemed to be to the doctors was just such a dramatic jolt to me. It's like, well, damn, I better come up with a better way of doing this then. And that's how it actually all started for me.
That's great.
So, thyroid, where are we at time-wise?
We have 15 more minutes.
How many?
15.
15. Okay. Any more thyroid questions?
I just want to go back to the glucose thing.
Yes.
Do you see, in general, with the healthy glucose that you were talking about, do you see a relationship between reverse T3 and glucose?
Enormous.
Okay. Yeah, I was just
healthy
wondering about
metabolism. It all works together, and that's why, that's why it is important when I threw in these things at the end about B vitamin metabolism is important in this, and good fats are important in this, and of course, we talk about transcend in the beginning, right? Talk with your doctor, relaxation, all these things. Your body has an amazing ability to heal itself. I am so overwhelmed by how wonderful it is, okay? And most of us don't see it because we get snowballing in the wrong direction, okay? And yes, it can start getting worse and worse pretty quick too if you're not doing the right things, especially everybody's telling, oh, your diet doesn't. Seriously, oncologists tell people that the diet doesn't have anything to do with it, and it does. And it has a lot to do, we don't want you to feel guilty. I don't want anybody feeling guilty, okay? But be responsible. It's a different thing, It really is. I mean, But we've gotten that. Trust me, our society has taught us a lot about, if you take responsibility, no one to be blamed. And we get guilty. And what happens when we feel guilty about something? We do more of the behavior that got us into the trouble to begin with. And then we see that's the way it works. So getting people to be responsible without feeling guilty is actually a tremendous challenge. Okay, so yes, the blood sugar works on that. And that's why there's so many windows to get into. That's why it's beautiful in terms of this healing thing, okay? And that's why so all senses for healing. Healing isn't just what you put in your mouth or in your vein, or as far as that goes, okay? It's music. Can you upregulate your metabolism? Can you change the way your brain functions by listening to music? Heck yes. By the right essential oils. Can you heal yourself that way? Heck yes, okay? Laughter, is it a good medicine? Sure, okay? I mean, and you utilize all the things without thinking about it too much, and you can heal yourself, okay? Without having to figure it out either, okay? People are trying to figure this stuff out, and I'm telling you, it's more complicated than you have the ability to think. That's what Einstein said. Pretty bright guy, okay? So, I'm not telling you to give up thinking. I'm just telling you, if you think you can figure you out, good luck. Because you're being led in a direction. That's my whole point. It's my favorites, okay? This is you. This is WebMD. Okay? It's going to make you so happy. So that's it. We're being led. I know it's, I really do think one set of movies I liked was The Matrix. I really think that is a great assessment that most people would rather believe they're eating steak than actually get the gruel. I really do believe that, and they would sacrifice humanity to do that. And so I got to think, I really think we got to pull the blinders off and actually say, wow, sometimes it means eating gruel. Okay, sometimes it means exercising. And yes, it's a wonderful thing when you start to do those things because you feel so much better. And no, you don't need deep fat fried butter.